Hello, welcome to our video about teen suicide. Just like with all the mental health stuff we've talked about so far, really, I know that this can be a triggering and heavy topic, but I hope that if you do deal with suicidal thoughts or you know somebody that does, you get the information that you need out of this. And there's always tons of resources out there for lots of mental health conditions because I think even though mental health is a tough topic sometimes, it's good to know that we live in a time now where it's accepted that we all have mental health. We know that. And we know that sometimes mental health isn't as great as it is at other times. And we know that there's tons of resources out there for us, and there's always help available. Teen suicide, what is it? It's the act of intentionally taking one's own life. Many adults who kill themselves are suffering from depression, another mental health condition, or are using drugs, substance abuse issues. Teens, on the other hand, often see no other way out, and it's more of an impulsive decision. And that's not to say teens are always impulsive or something is wrong with them. That's natural. That happens in adolescence across lots of different species. The frontal lobe, which is the decision making center in teenagers' brains, is not fully developed. And so decision making skills are often not as sharp as they would be as the person gets older. And it doesn't magically change when you turn 18 and become an adult. Usually frontal lobe development does not fully happen until the person is about 25 years old. The problem wasn't going to be permanent, but the person chose a permanent solution. And I think that's a good quote. Any problem that you ever face is not going to last forever. It doesn't mean that it's not a serious problem. It doesn't mean that it's not causing you significant mental stress. However, it's never going to be a permanent problem. There's always solutions, and suicide is a permanent solution to a temporary problem. Warning signs of suicide, talking about dying, preoccupation with death, talking about not being around. So they could say something like, oh, well, I won't be around for that anyway, or I won't be suffering with this much longer. Writing about dying, really, like I said, preoccupation with death or dying. Those are verbal signs. That's the person is saying things and you can hear them and respond to them that way. But there are also some nonverbal signs. If you notice that they're withdrawing from friends or normal activities, if they're engaging in using substances, if they're giving away their possessions, or you notice a major shift in personality. It could be like you notice that the person has seemed to be depressed for a long time, but then you notice a sudden uplift in their mood. And that seems kind of counterintuitive. Why would they have an uplifted mood if they're going to commit suicide? And the reason for that is because the person thinks that, oh, this is my way out. So I'm not going to have to be suffering for much longer. And it makes them feel better. Obviously, that is not a good solution and it never is a solution, but that's where that is coming from. Reasons for teen suicide, suffering from depression, see no other way out. We talked about that. The thinking that these feelings are going to last forever, which they will not. Family issues, feeling like a failure. They cannot express anger or pain. Substance abuse, alcohol or drug use. Unrealistic view of death or suffering loss. Any one of these could be reasons, and it's not an extensive list. There could be other reasons that aren't mentioned here. Myths of suicide, the person just wants attention. Suicide is selfish. That's not true. Think about it from their perspective. They are so down and they're so depressed and they're struggling so much that they see no other way out. They don't want to hurt anybody and they just, again, don't see any other solution to their problems. Suicide only affects those with mental health conditions. Sometimes that's the case, but it doesn't always have to be the case. It could be something that happens suddenly. Maybe that person was in good mental health before and they suffered a loss and quickly became very depressed very quickly. And So there's really not saying that everybody that commits suicide has a mental health condition, because that may not be the case. Another myth is that you should never mention suicide to them. Talking about it can actually help, because the person feels this release of, I don't have to keep it a secret anymore. Now somebody knows, and I don't have to keep all these feelings buried deep down inside. There's birds outside, and that's why they're going crazy right now. So I apologize for the tail switching in and out of the screen. And another myth is, once an individual is suicidal, they will always remain suicidal. This, just like any of the other mental health conditions that we talked about, can be treated. Treatment is always available. Talking to a therapist, getting on medication, some sort of cognitive behavioral therapy. Really, there are a lot of solutions to feeling suicidal, and suicide is not one of those options. How to help a friend if they come to you and say that they have suicidal thoughts. If the risk is imminent, if they're saying they're going to do this right now, then call 911 or go to a hospital. Take them to a hospital. The first step is to get involved. Make sure that you're involved with them. Tell a trusted adult as soon as possible. Show support, validate their feelings, listen to them, and keep them talking. If you're on the phone with them and they're saying they're having these suicidal thoughts, keep them talking. Talk to them about something else while you get help. And just, like I said, keep them talking about something else to distract them. Don't offer quick solutions. Just stop thinking that way. Just don't do it. Just do something else, right? Those aren't good solutions, because the person is suffering so much that they're thinking about taking their own life. Things like just stop thinking that way is like telling somebody with an eating disorder to just eat or just stop eating. It just doesn't work, because these are deeply entrenched mental health conditions. Remember, disorder means that something is not right in their brain, and that's the case for any of the mental health conditions that we talked about. It doesn't mean that they're crazy or something is wrong with them, but it literally means something is not right. And something is not right for a person to consider taking their own life, and that's why they need to get help. Take care of yourself too. I think I mentioned this in every one of these screencaster videos so far. Make sure that what the person is telling you is not affecting your mental health so negatively that you are being affected. Everyone's going to be affected by it, but make sure that on top of dealing with the problem, you're also taking care of yourself too, and that's really important. So think about, what are some warning signs? What are some things you can do to help? What are some myths and facts? Maybe pause this video to think about a couple of these things now. And remember, please, please, please reach out for help. There are a lot of different helplines available, and I'm going to send those out too. Here is the National Suicide Prevention Lifeline. As always, talk to any trusted adult, teacher, counselor, therapist, anybody that you feel like can help you with this situation, if it's you that's struggling or if it's somebody that you're trying to help. Let me know if you have any questions about this, and talk to you guys soon.